Hi, I'm Pete, and we're going to talk about shoulder pain for just a second here. All shoulder pain, I don't care what anyone says, all shoulder pain is due to, or shoulder injury, is due to the position of the shoulder. And here's what I mean by that. Shoulder is a ball and socket joint, ball and socket. We can see it right here, ball and socket. I don't have the $20,000 video animated to show you properly, but here's the ball and socket, and when it gets out of position, in other words, when that shoulder joint hinges forward, you lose the ball and socket function, and now that's putting pressure on the rotator cuff, on the tendons and the ligaments of that shoulder capsule, and that's the precursor for the shoulder injury, okay? Here's how it works. Stand in front of the mirror, and what you're going to see, you're going to see those shoulders hinge forward. You're going to see the backs of the hands, and there's going to be very little space between the arms and the body. So we know your shoulders hinge forward. That's why you have the injury. That's why you have the pain. And the only way to get yourself out of this once and for all permanently is to get the shoulders back into the proper position. And it's muscles that tell the bones what to do. So we have to get the muscles, the interaxial muscles, that are around this shoulder girdle. Those are the very tiny muscles that are close to the skeletal structure, and those muscles are the ones that tell this shoulder girdle what position to be in, okay? So you can do 1,000 rows on a rowing machine, and you will not get those shoulder joints to go back into their proper position. It has to be the interaxial muscles. So actually, we can do something real quick right here. As you're watching this, I want you to get small knuckles with a hitchhiker thumb. We're going to put those right to the temples, and we're going to go all the way back, and we're going to go all the way forward, and then all the way back. This is called an elbow curl. And by doing these elbow curls, and we're going to do 25 of them, so you keep doing the elbow curls, 25, keep going all the way forward, all the way back, a lot. At times you're going to be bending at the wrist. You don't want to bend at the wrist. You want that hinge to be right there at the temple. You won't be able to do this at first. I haven't seen very many people at all be able to actually do this properly first go. And we know the shoulder's out of position when we can't. So keep doing these. When you get done, go back to the mirror, and you're going to see those arms come out, and the hands in a better position, that shoulder going back. So that's just a little taste, a little sample of the things we're going to do when you come in and visit me for 1 hour. I'm inviting you to do that. We're going to have some fun. We're going to work those interaxial muscles around the shoulder joints, and we're going to reposition that shoulder, and you're going to be out of shoulder pain once and for all. Thanks for visiting.